Everyone, lots going on still with the coronavirus because, well, it's impacting pretty much everything from local schools and now daycares and to federal plans being updated on the fly daily via Twitter. And I want to talk about quickly the local stuff. So it first started that the schools would be closed starting yesterday, the 14th, March 14th. Today's the 15th. And be closed for 3 weeks till April 6th. And shortly after that, the daycare closed. And that was yesterday evening. But in addition to the daycare, pretty much everything else locally closed. Not just the NHL games, but the local Guelph Storm team is not playing either right now. And Square One is reducing its mall hours from 11 to 7 p.m. because, I guess people aren't going shopping at 8:30 because they don't want to be around people, right? So the impact of this is vast and far-reaching and far exceeding the infection rate of the virus. But it's it's interesting to watch how this is impacting the economy, right? Like, Walmart's not empty, but my goodness, there's a lot of shelves that the workers were working really hard to quickly restock the other day. And all of this stuff impacts, right? And our leadership, Justin Trudeau, is modifying the plan that he rolled out a couple of days ago, $1 billion package, right? $500 million in healthcare aid and $2 million to the WHO and $50 million for international aid. Why? Because anyway, regardless of all that package, here's more on that. If there was the $10 billion in support to Canadian businesses through, I think, the Bank of Canada, why wouldn't he announce that? That's an important aspect, right? I guess, I don't know, maybe he was just focusing on the healthcare aspect of things, but it seems odd. It seems weird. Anyway, here's the tweets that Justin Trudeau was tweeting yesterday, March 14th at noon-ish, 12:30. Around the world, the COVID-19 situation continues to evolve rapidly. I want you to know that we're working around the clock and doing everything we can to support our economy and keep you safe. And yesterday, we announced additional measures we're taking to do just that. They're not suspending flights. Mark Garneau announced that we're delaying the start of cruise ship season until July 1st at the earliest, and we're not allowing any cruise ships to dock in northern communities this season. More on how this will help prevent the spread of COVID-19. Bill Morneau also announced that we are providing $10 billion in support to Canadian businesses through BDC. I think that's Bank of Canada. And Export Dev Canada. This will help stabilize our economy and protect workers' rights right across the country. Get more info on this support here. FP Champagne has advised you that all non-essential travel outside Canada has advised you to avoid all non-essential travel outside of Canada. We've also enhanced screening and detection processes for all international airports and land border, ferry, and rail ports of entry to slow the spread of COVID-19. More info here. I'm going to talk a lot about this today because it doesn't seem like this is true, but perhaps 20 hours ago they started a change that hasn't rolled out at the airports yet. But I've got a lot of tabs to show you about the screening processes that are in place in our airports. They're not nearly good enough. Moving back to Trudeau's tweets. These are significant steps, and we will do more if needed because protecting our economy and keeping you safe is our top priority. Wait, which one? Which one did he list first? Because protecting our economy and keeping you safe is our top priority. Which one's the top priority? By virtue of listing it first, the top priority, everyone, is the economy. We are protecting our economy, everyone. The economy is not in any danger. It also cannot get the virus. Well, I guess it's already got the virus, hasn't it? And it's on life support, on government-funded life support at this point in time, right? So, protecting our economy, and you guys too. We'll keep you guys safe. We'll continue to work with others, with all orders of government, businesses, and public health officials, and we will get through this together. Okay, so that's what Justin Trudeau is saying. Here's Maclean's, and this was published yesterday with data up to the 13th. These are the numbers. And exponential growth takes a little bit of time to get started, but once it gets started, it gets surprising very quickly. So today, and you can see there, we're just around 200 cases. 198, I think, is the official number on the 13th. We might be over that now. I'm sure we're over that now. And here is, we're going to get to the Ontario numbers in just a minute. 98, maybe that's where the 98 came from, but we're at 103 in Ontario with the 5 plus the 98. But But here is Ontario reports 24 new COVID-19 cases. Provincial total rises to 103. And this was published yesterday and updated yesterday at 6:16 p.m. Okay, so here's I was telling you earlier that I had 16 cases in Ontario with no clear travel connections, and this is the tab for that. So it says many new cases involve people with international travel history, though the transmission source for 16 of them is listed as pending. I scroll down. The majority of them are in Southern Ontario, 9 in Toronto, 1 in Peel region, 3 in Durham region, 1 in Halton, and 1 in Hamilton. I like how vague they are. Toronto, Hamilton, and then, Peel region's got a couple, Durham region's got a couple. Don't worry about it. You live there. Don't worry. It's okay. We're not going to give you the city, though. Right? Isn't that? No, I would be frustrated by that. It would be like Wellington County getting a case. It's like, great, thanks. Wonderful. Thanks for your clear transparentness. It's interesting, right? Here's back to the article. Others were reported in Middlesex, London, Waterloo, Huron, Perth, Ottawa, and Kawartha area. On Friday, the province confirmed 19 new cases of COVID-19. So 19, then 24, and probably tomorrow will be in the 24 to 50. And then it starts to take off, right? And I hope that we've caught it before that. There's a lot of stuff that is not happening at the local level that is impacting those numbers. So hopefully we don't see those exponential growth. But this thing has such a long incubation period that we could see that growth anyway. And we're still landing people from infected areas, right? Like, it seems crazy. Here's the official Ontario numbers. They've tested 6,000 people, and they're limiting who can be tested. I'll talk about that in a minute. Here's Francois Philippe Champagne, and he says, official advice to Canadians abroad. This is 19 hours ago. We recommend that Canadian travelers return to Canada via commercial means while they remain available. That sounds ominous, doesn't it? Doesn't that sound ominous? That sounds a little bit more like, if we're saying come back now while you still can, while there's still planes flying, while there's commercial means necessary or available, it sounds more dire than what we're being told. I wanted to talk about this being transmitted by aerosol. Now, I've heard, I'm giving you secondhand information here. I'm not a doctor or anything to that effect, but Dr. John Campbell, who I haven't watched in a couple of days because the more I talked about him praising China, the less I liked him. Anyway, he does provide good information regarding the medical aspect of things. And he says aerosolization is kind of on a spectrum, and the droplets are heavy and fall within 10 meters, right? So 10 meters is still pretty far. But if you sneeze, those are heavy, those are big droplets, right? And those would have to land on hands or land on surfaces and then be picked up by hands to reinfect. Aerosolization is smaller and can go further, so tens of yards, right? Which is further than 10 meters. And so because of that, this is heavier than that aerosolization, but is still aerosolized enough to infect an air-conditioned bus, right? And this is the map of how people got infected. And there's many passengers sitting far away. I don't know if it takes into account masks or any PPE that people were wearing or anything like that, but this is aerosolized regardless of what people are saying. So the numbers are going up. The travel advisories are out. In fact, they're saying come back to Canada if you possibly can. And they're limiting testing, and they're making it kind of makes sense. If you have symptoms and you traveled, they're saying that's a probable case, and they're not going to test because you've probably got it. We understand that you've probably got it. So that's what's happening here. They're prioritizing the tests for people who they're unsure about, right? So if there's reasonable doubt or something to that effect, and to better make use of the short supply of tests, that's how they're doing it. So hold on a sec, I'll highlight the important part. Individuals who are still eligible for testing include people with symptoms who are contacts of confirmed cases, those who have been admitted to hospital with acute respiratory illness, healthcare workers with symptoms, or who are part of an investigative team into an institutional outbreak, like one of the old elderly care homes outbreaks, people living on long-term care homes and retirement homes, First Nation community members living on reserve. Testing outside of these recommendations based on public health and clinical judgment can be made in consultation with local public health officials. So, limiting testing. Okay, so it took me 10 minutes to get to what I thought was going to be the main meat of the video. So this is the second half of the video, and I'm just going to finish it. So I can't split it up. I don't have enough time this morning. I'm sorry, everyone. Okay, so this is Christia Freeland. She is talking about the enhanced screening at the airport. This is March 12th, okay? They have been telling us that they've been doing this. They have been saying this has been since mid-February, and it has not been true. But here's Ms. Freeland to say it one more time. Here we go.
We are constantly reviewing what is happening at Canada's border. We already have enhanced screening in place for people arriving from countries where there is an outbreak, a bigger outbreak. Coronavirus is now all over the world in more than 80 countries. But in countries where there has been a larger outbreak, we already have enhanced screening in place for travelers from those countries. And we are constantly reviewing what we're doing at the border. I would like to add two things to.
So the mom tone, the mom head tilt, telling us everything's fine. We're screening lots. Screening away, screening. Okay, so here's the thread that is talking about how they're not screening at all. And he says thread. So there are plenty of examples that have been tweeted today that suggest what the government claims about their enhanced screening measures is incorrect. And here's the first one that says it's the Canada Border and Services Agency. And I personally dislike a lot the fact that they use these little emoji things. Could you let's use the language, for crying out loud, okay? We have English, it's very nice, and French is good too. Let's use the words instead of pictograms, all right? Anyway, it's just frustrating. Canada Border Service on March 14th at 10:07 p.m., that's last night, tweets, quote, enhanced screening has been in place at all airports since February and at all car, rail, and boat ports since early March. Ports. Travelers, no matter their country of origin, are assessed on arrival to Canada. Additional measures include providing instructions for travelers who have been to the province of Hubei, China, Iran, or Italy to self-isolate at home for 14 days and report to local public health officials within 24 hours of arriving in Canada. Providing instructions to travelers arriving to Canada from other international destinations to self-monitor for symptoms and to consider self-isolation for 14 days. Displaying additional signage to raise traveler awareness at airports. Offering travelers a general COVID-19 information handout at all ports of entry, using health screening questions to identify travelers of concern, providing travelers of concern a mask kit consisting of a surgical mask and one-page instructions on how to use a surgical mask, working with the support of Public Health Agency of Canada officers to screen travelers who may pose a risk, and screening of travelers who may be unwell in the customs hall and at ports of entry for the most up-to-date info on COVID-19, blah, 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 blah. Okay, so that's what they say they do. That's what they are saying they're doing. And here's our examples of what is not happening. For example, a national columnist who went through screening this evening was faced with a computer kiosk and that asks one question and was then waved through. Here it is, Matt Gurney. A lot of people are asking if I was screened when I just returned to Canada. Yes, I was, by a computer. It asked me one question. I honestly clicked no and was told, and that was that. A human reviewed the printout, asked me where you're coming from, and instantly waved us through. I timed the entire process from entering the customs area to exiting the baggage claim area. That's minutes and seconds, just to be clear. 6 minutes, 16 seconds, 80 milliseconds. And so, interesting, right? Here is another one. That's one. Or this reporter who was only asked if they had traveled to Italy, China, or Iran, no questions about symptoms, or if they had been around anyone with COVID or symptoms. Here, we'll listen to this. It's worthwhile, I think.
China. Just waiting. My husband's getting the luggage with the kids, but I just wanted to let you know what we were asked at customs. We were asked if we had traveled to Italy, China, or Iran. That's it. Was not asked if any of us have symptoms, if we have fever, if we were around anybody who had COVID. Now, I don't know what the methodology is, and if this is what the procedure or the proper protocol is, which it might be. But I just thought that was interesting. That it was only that question if you've been to those countries within the past 3 days. Again, we are coming back from Mexico, and we are going to be self-isolating for 14 days. We were planning to stay away from our parents who are older, but we are now staying with everybody and work, of course. So, yeah, new reality, everyone.
So, a couple of questions, but not really an in-depth screening. Here's another, or this reporter who was asked where they were coming from and why they were there. Abigail Biman says, back home, for those wondering, at the Ottawa airport tonight, I was asked on the customs forum whether I'd visited Iran, China, or Italy, but there were no other questions or screening regarding symptoms. The agent only asked where I was coming from and why I had been there. Or this individual that went through Pearson earlier today and experienced zero screening, not even hand sanitizer in the lineup. And this is this one, I believe. Yep. I've been in the Canada Customs line at Pearson for over an hour long with hundreds of people, 6 agents on duty, zero screening, no masks, no sanitizer in sight. This is as unsafe as it can get. Coronavirus Canada, Canada Poly. And here's the pictures. Could you... I mean, like, you know, that kind of looks like what customs looks like anyway, but can you imagine 2 people with coronavirus in there? How about 6? How about if nobody knows? How about 10? Right? How quick does that spread in those close quarters? And we just talked about aerosolization, right? You think they're closer than the bus? I mean, this is the infected guy, and these are the people who got infected, right? A cough or a sneeze or an ill-timed exhale. I read in the New York Times. I don't read the New York Times very often, but it said if you can smell what the person had for lunch, you're breathing in their you could potentially be breathing in virus. Now, I don't know how accurate that is, but that's what the New York Times said. Here's back to the tweet thread. This ETV reporter that spoke to travelers going through YVR that saw or experienced no enhanced screening. There's nothing happening in the airport. It's insane. All other airports have been really spot on. This airport, nothing happening, said traveler Emma Logan. And there's an article there. Oh, I think I actually went to it here. Yeah. International travelers at YVR say they're not seeing any extra screening. So it's concerning when the government's saying one thing and like people on the ground are saying, yeah, that's not really happening. Not at all. This Ottawa medical doctor whose family returned from Mexico today and reported that no one was telling travelers they should self-isolate. Here's that. Enhanced screening. My brother-in-law returned from Mexico 2 hours ago. He just sent me these texts. Literally not one mention at airport of self-quarantine. Crazy they aren't telling people. Yeah, it seems a little nuts, especially since they're telling Canadians that they are telling people. Or this individual who's on the last flight out of Italy on Wednesday and found no one screening for symptoms at the Montreal airport. And I was on the last Air Canada flight out of Italy on Wednesday. Screening questions in Montreal only asked about travel to China and Iran. No screening or symptoms. Or this individual whose family member returned from England and Switzerland on Monday and breezed through customs in minutes. My mother returned from Egypt and Switzerland and went through customs in 5 minutes with no screening or questions on Monday. She's now self-quarantining. Proper measures, my ass. Or this individual who returned from Sydney earlier today who reports that staff didn't even mention the outbreak to him. I just returned from Sydney this morning, a city with famous people infected in public places. The only reference to the outbreak is the customs form if you declare travel to Iran, China, or Italy. There's no enhanced screening or even a mention of the outbreak from staff. Or this man whose family came through Vancouver from Hong Kong and didn't go through any screening. My family just arrived from Vancouver, YVR, via Hong Kong, walked right in with no screening at all. What is going on, Justin Trudeau? COVID-19. Or this City News reporter indicating that the final flight from Italy faced no screening. No screening. See? This is just a quick set of examples I was able to find that contradict what the government and the government ministers are saying on their own. These reports and experiences are quite alarming considering what the world is going through. Yeah, Italy. So what's real and what's not? So I took the CBSA Canada Border Twitter thread and forwarded it to a close friend who just flew through Vancouver last month from Asia to ask them if it was legit. Here's the screenshot of their response. I can confirm that February 22nd, when I flew into YVR, there were no people or machine asking me if I'd been to China or if I felt all right. No word of novel coronavirus and no informational pamphlet. So what's going on at our airports? We are faced with official talking points from the government and several cabinet ministers versus first-hand experiences shared on Twitter. I'm inclined to believe the diverse reports from doctors, reporters, individuals, and friends, to be honest. Another friend has weighed in with this text, and this is the last one. Can confirm, zilch from me at YVR Customs from an international flight from a country with confirmed cases as of March 5th, with confirmed. Right? So somebody's not telling the truth, and I think it's Justin Trudeau that's got a history of that. He assured us that Jody Wilson-Raybould wasn't pressured, right? And he assured us that his vacation with the Aga Khan was totally above board. He was fine, right? Right? Everything's fine. Here's passengers from Italy face no screening. We're doing screening, says Canada. It's Justin Trudeau with his hair and his eyebrows and whatever. He says it right into the camera, doesn't he? I'm looking right at Canadians' balanced budget in 2019. It's bullshit. It's bullshit. It's bullshit. It's bullshit. It's bullshit. Christia Freeland. It's bullshit. You're lying. I mean, like, it doesn't get more clear than that, really, right? We're not feeling very safe. Employees and passengers question COVID-19 screening. Yeah. Make no mistake, Italy is not an outlier in this global pandemic. Okay, so this video is already long enough, and maybe I should have ended it at the bullshit part. But here we are, and I didn't, so carry on. Thanks for watching, everybody. Check out CanadaPoly.com, CanadaReport.co, and have a wonderful, wonderful day. And don't believe the bullshit.